think it's quite surprising for many people to understand that dental disease and oral disease can lead to some really significant health problems. We also know that even dental diseases that many people might perceive are relatively harmless, like tooth decay, can lead to hospitalisation and adults and children getting quite sick from their teeth.
A new statement reflecting the latest research into oral health has been released by the Australian Dental Association. It's the first time they've updated the advice in over a decade.
One of the changes of this new statement is the fact that oral health is integral for health and wellbeing. And this really follows messaging that's going around the world from the World Health Organization, which recognises that there is no universal health without oral health. We also know that there are growing links about the connection between oral health and other diseases, particularly what we call non-communicable diseases. So things like obesity and diabetes, Alzheimer's disease. And we're still trying to understand those processes a little bit more, and there's still a lot of research that needs to happen. But I think it's not altogether surprising that the mouth is connected to the rest of the body. Brushing, flossing, reducing the amount of sugar, and making sure that there's timely and regular dental checkups are probably the foundations of making sure that people have healthy teeth. But of course, there are lots of things that come into oral health. And so this statement, for example, includes important points about smoking, alcohol use, vaping, the use of mouth guards, for example. We know that mouth guards can be really effective in reducing traumatic injury in the mouth. So one of the things that's really changed people's oral health has been community water fluoridation. And this is certainly the case in Australia, where many people have access to community water fluoridation. It's really led to a reduction in tooth decay, particularly in adult teeth.
But although there's a marked decline in adult cavities, it's the reverse case in children.
It's hard to know exactly why we are seeing persistently high or maybe even increasing rates of tooth decay in children. It may well be that sugar is more readily available. It's also very hard with marketing and advertising these days for parents to tell what's got sugar and what hasn't. That's why we have a message about the first dental visit happening at 12 months of age or when the first tooth comes through. It's really important to start that process really early because we know we can prevent tooth decay. My advice to parents is to make sure that they connect in with their dentist and make sure they take their child for regular dental checkups. We know that brushing twice a day makes a difference. We know that fluoridated toothpaste is really important. So definitely focus on that toothbrushing and then look out for sugar. Those basics will help.